maybe we'll give it just a minute or so for people to sort of trickle in, but maybe we could start with you just introducing yourself. I feel like that would be,
Yeah. Totally. Hi, everyone. My name is Carolina Jimenez. I use she, her pronouns. I'm a registered nurse, and I am the coordinator of the Decent Work and Health Network. I live in Toronto, and I nurse at a women's clinic in the west end of Toronto. And the Decent Work and Health Network, we are a non-for-profit group who look at work and health, and we do advocacy to improve working conditions as a means to improve health and the quality of life of our patients in our communities. So it's been super important during the pandemic. We've been very busy, but also really great to be channeling some of the frustrations that we're feeling into advocacy for sure.
Definitely. I've been following the account for some time, and I was so glad that we got to connect, because I think the work that everyone at the Decent Work and Health Network is doing is just incredible, essential, just really on the side of people who work everywhere. So that's really great. I always forget to introduce myself on these things. I'm Sam, and I founded the OnCanada Project back in June, but I now do it alongside 150 other incredible volunteers. So it's not just me anymore. I feel like I have to say that because they're pretty kick-ass. Okay, so let's jump into it. I'm really pumped that you had some time to talk about this, because it's obviously something that's on a lot of people's mind. We're seeing a lot of conversations and buzziness around the concept of mandatory paid sick leave. But before we jump into that, could we scale back a bit and talk a little bit about the correlation between decent work and health, and why that's a part of the discussion right now?
Yeah, for sure. So the term decent work, it's actually a concept that comes from the labor world. So I pretty much got introduced when I started to do some labor advocacy. But what it does is that decent work are the types of conditions that allow people to feel dignified in the work that they do. And so these things are like fair wages, they're decent hours, so good scheduling, respect, no discrimination in the workplace. It's things like benefits, and it's things like paid sick leave, paid time off for bereavement, and so on. And we know that, for example, the Canadian Medical Association, they did a big study in around a few years ago, and they found that income is one of the most important social determinants of health for Canadians. And for the majority of us, how we make income is through work. And so what we see is that there's a direct correlation between having good working conditions, like enough, making adequate wages, and health. I mean, this makes total sense, right? We spend so much of our time at work. Even when something goes off with work, like I personally feel like a little bit off and hard on myself, but you can imagine the effects of having things like not having enough wages to pay your rent, to pay your food, to pay for your prescription, not having, a job that provides job security, like so many temp agency workers who are waiting for a call. You can imagine what that does to you as a person, and subsequently what that does to your health. So yeah, definitely those two are hugely linked.
And why is that even more evident and important during a global pandemic like the one we're finding ourselves in right now?
Yeah. So as we've seen, workers make the world go around. Workers have been taking care of us. They've been delivering our food. They've been transporting us. Workers are such an important part of how we live our lives. And something that the chief medical, the public health officer of Canada said is that no one is protected unless we're all protected. And that's exactly what we've seen when workers are not protected. Not only is it harmful for their health, but it's also harmful for communities' health. So in the context of a life-threatening pandemic, what this does, and I want to give the example of like nursing homes, for example, right? So when these workers disproportionately racialized women making low wages, when they didn't have appropriate wages, they had to work multiple different jobs at multiple different areas, and we saw that sort of workplace precarity or precarious work, which is the opposite of decent work, led to a sort of a wildfire increase of COVID-19 in the workplaces. And so the importance of decent work during the pandemic is that workplaces are driving the pandemic. And we're seeing that especially play out with the third wave. And particularly areas that have more precarious work like warehouses, construction, manufacturing. These areas are the ones that are like 68% of Toronto's cases, I believe, is the most recent. And not uncoincidentally, these are also the places that don't offer paid sick days to allow their workers to stay home sick. They use a lot of temp agency work. They don't have very good benefits on the job. So we see that intersection play out very clearly.
Yeah, I mean, I'm sure, and I know this from like people who sent our account questions and stuff, but there's been a lot of confusion um, around how the virus is spreading so much now. And I think often we hear a lot of rhetoric around like, well, just stay home, and just if you're not feeling well, don't go into work, or you know, that type of stuff, which is um, a little misleading, I find, because that's under the assumption that people have that option. Do you mind kind of chatting a little bit about that and why the third wave is kind of hitting really hard, even though we've been told for months now to stay home?
Yeah, totally. So I want to talk about how being able to stay home without, making money, without having that revenue stream is privilege. And a lot of low income essential workers don't have that privilege. And there's lots of barriers with the, quote unquote paid sick days that is being promoted right now, the Canada Recovery Sickness Benefit, and we'll talk a little bit more about that later, but it doesn't fit the bill. So it's a privilege to be able to stay home and isolate. And I like making the connection. So as a registered nurse, like when I give someone a prescription, if they don't have the money to be able to fill that prescription, it's like an empty prescription, right?
Right.
And similarly, when public health and other health officials tell people to stay home, if they can't afford to stay home, then how are they actually going to stay home? And what we know is that the majority of Canadians don't have paid sick days. For example, it's close to 60% that don't have paid sick days. This number increases to over 70 if you're low income, is even higher if you're a woman. So the vast majority of people who are on the front lines, we see these lockdowns, but they're still having to go to work. They still have to take public transportation. They're still at high risk of getting COVID, and are also the ones that are least likely to have protections on the job, like paid sick days that actually allow them to stay home. Right. So from a public health perspective, if we are telling people to stay home, we also have to make sure that we're putting policies in place that meet the reality of workers' lives so that they are able to follow that advice. Otherwise, like I said, it's like a prescription that people can't fill.
Mm-hmm. Right, and that's not really on the individual, it's really on the system itself for not facilitating it and making it possible.
Well, that's just it. Like we're seeing so much discussion around it being a lot of finger pointing, right? And people are really looking at this from like a behavioral perspective. Oh, it's the youth who are driving the pandemic, or it's like people who aren't following rules. No, it's actually, this is a structural inequity that requires a systems level equity solution, which is exactly provincially legislated paid sick days, to allow everyone the access to stay home as soon as they need to, which is also from like a medical perspective, as soon as you start showing symptoms, that's when you are most infectious. So if you don't have access to paid sick days right away, then you can really, you transmit the virus, because that's when you have the highest viral load.
And that's often also when people, like just at the beginning, you're saying when the symptoms start. So I feel like there's a chance you might be able to think that it's maybe just a cold or it's not
Allergies.
real, right? So you could like just unknowingly be running around because you don't have you don't want to risk losing work. Um, that really sucks. That's not fair. To
No.
be, no.
And
Um,
especially that these people are, are putting their lives on the line, right? For us to be able to stay at home and to work from home, right? Like
right.
that's such an honor, really.
It really,
So we really have to do everything we can to protect workers on the job, like full stop, like whatever it takes. Like give them these protections not only during the pandemic but permanently too, right? At the Decent Work and Health Network, we say that precarious work is a health hazard, and that is exactly what the pandemic has shown. No paid sick days, poor wages, um, no job security. These things are a health hazard, not just to individuals, but also to communities, in particular, Black and racialized communities.
right. So you said this a couple times, but I'd love like a clearer sort of understanding of just what does precarious work really mean, and then maybe tying that into our account is there's a lot of people who follow our account, but the vast majority of them are millennials and Gen Z. So maybe speaking a little bit to that as well.
Yeah, for sure. And actually, just from what I've seen, millennials and Gen Z folks are like disproportionately a lot of us are in precarious work, and these are work situations, for example, a lot of the time in retail where they're folks don't get a lot of hours, they don't get really
Mm-hmm.
good wages, right? Those are components of precarious work. In the food and the restaurant industry, very notorious for having like very poor health and safety. Even before the pandemic, like we've heard stories of people going to work sick and like making your food, right? These are it, right? The kinds of conditions that lead to people feeling like they have to meet these productivity targets at Amazon warehouses. Um, for example, a lot of couriers, right? Whose employer is an app. What does that look like in terms of your protections
Mm,
on the job?
right.
Um, that's something that's called misclassification. And misclassification is something that you were misclassified as like a freelancer, but we know that people who work for Ubers aren't necessarily freelancers. They're actually
Right.
like employees of Uber. So, and we can have a whole other conversation around misclassification, but that's one of the problems of gig work is that you actually have um, no protections because you're not truly like an independent contractor. You're not truly um, uh, a self-employed person, but sort of these apps kind of get in the way and you don't really have any protection. So I'm seeing a lot of that in sort of like millennials and
Mhm.
Gen Z, in terms of folks, not a lot of unions either. Like we see that a lot of these like sectors that I just described also don't have like the protections of unions. Um, and when we think about it also, it's not just disproportionately affecting like millennials and Gen Z, it's also disproportionately, this precarious work is affecting like BIPOC and marginalized communities, right? Like we have to think about the biggest outbreaks and where those have happened. And so, like, okay, let us think. So it's been long-term care homes have been really bad
Mhm.
in terms of outbreaks from the outset of the pandemic. No surprise that it's been mostly racialized women. We think about the horrible outbreaks that happened in the farms in Ontario that largely employ migrant agricultural workers who
Mhm.
put food on our table. We think about one of the worst outbreaks to date, which was in the Cargill meat processing plant
Yeah.
in Alberta. which employs largely Filipino workers making low wages and no paid sick days. And we think more recently to the outbreaks in manufacturing, in shipping, in Peel region, which is a stronghold of temporary agency work, also a stronghold of warehouses. And I think that one of the signs for like Brampton is like all roads lead to Brampton, because it's the stronghold. It's like such a distribution center, right? Uncoincidentally, Peel region has had the highest persistent COVID-19 positivity rates, right? So we look at these different examples: long-term care, farms where migrant workers are employed, Cargill meat processing plants, these warehouses. And it's no surprise, right, that the disproportionate impacts that COVID-19 and the lack of workplace protections are having on Black communities, on racialized communities, it's there. So by advocating for paid sick days for all, we're actually really including equity into our lens, which is super important in what we're doing, because like I said, these people are the unsung heroes of the pandemic who continue to put their lives on the line. So yeah, I hope that answered that question.
No, it definitely did. So I guess let's maybe talk a little bit more about the mandatory paid sick leaves and why there's been such a big push for that recently. What is a mandatory paid sick leave? Like, what would that give people if it was mandated?
Yeah, there's been lots of confusion about this, and I think for good reason. So I want to kind of take us through a bit of a thinking exercise. So for example, I want us to pretend that we work at a warehouse in Peel region. We are making about minimum wage. It's towards the end of it's middle of the month, so we have to start thinking about rent. Let's say we live alone. We think about all of the bills that we have, right? Let's say we're making like, I don't know, like $15 or $16 an hour. We don't really have a lot of protections at work. We don't have paid sick days. And I'm in a community that's in a hot spot of COVID-19. Whether I get COVID at work or not, let's just say that I have symptoms of COVID. Waking up in the morning and I have a bit of a sore throat. And you're like, well, I don't know what this is. Like, this could be a runny nose. End of the month is coming up. I don't have paid sick days. Like, this means that this is like $130 out of my paycheck. I'm going to see if I get better, but I still have to go to work. So you go to work. Okay, fine. On the second day, you wake up and you're really not feeling well. You're like, okay, shoot, I should go and get tested. But that means that you have to still miss out on that day's wage, which is like, if we're saying that it's about like $14, $15, this is about like $130. If I had paid sick days that are what we've been advocating for, that are like legislated and provided by the employer, I wouldn't have to worry about where that money for that day was coming from, because I would have that automatically on my next paycheck. All I would have to do is call my employer and be like, hey, I'm not feeling good today. I need to take this day off. I wouldn't have to worry about having to apply through another program. I wouldn't have to worry about waiting to get my money in a couple of weeks. I know that my money would be there 100% on my next paycheck. I don't have to worry about my bills. All I can focus on is taking care of myself. And that is why we're calling for provincial and legislated paid sick days, because we don't have that in Ontario. Actually,
Ontario has never had mandatory paid sick leave. Like, that's just never been a thing.
Yeah, so we did have them. We had 2 days. We had 2 days of paid sick days for a whole year in 2018, and then when the Ford government came in, they canceled that. So since 2019, we've had 0 paid sick days. They've been canceled by the Ford government. And what we're seeing with the Canada Recovery Sickness Benefit, or the CRSB, which is what Premier Ford keeps saying, is that we do have paid sick days. It would disincentivize me from taking that sick day off.
Mhm.
Why? Because I have to wait until I've lost half of my wages for that week. Then I would have to apply after the fact. So, for example, if I had to take like Tuesday, Wednesday off, and then turns out then I would have to wait until the Monday after to apply. The
Right.
money that I would get back is not my full wage. It's less than minimum wage, which I think it equals out after taxes about $12 an hour.
Wow.
Okay, so right, like let's think like about the bills that people have to, pay. Um, there are lots of eligibility criteria, which means that it's not an equity-driven approach like paid sick days would be. If you don't have a social insurance number, you can't apply. If you don't have a home in Canada, you can't apply. Um, so at the end of the day, like people just aren't in a position where they can sort of walk on eggshells and sort of gamble with their livelihoods. It's not fair. We need to provide every support we can for workers on the job right now, and
Mhm.
that means to bring back provincially legislated paid sick days. And something else that I wanted to say is that when the federal government brought in the Canada Recovery Sickness Benefit, which is more like an income support. So at the Decent Working Health, we're not saying that the Canada Recovery Sickness Benefit is bad. We think it's good. We just know that it's not paid sick days,
Right.
right? It's an income support if you need to take longer time off to quarantine, but it does not, like the functionality of this program does not allow you to take time off in a flexible way as soon as you need it. This program was supposed to be a supplement and to be a to help, sorry, it was supposed to be a supplement to the provincial paid sick days.
And
um
instead of like the instead of being pointed to as like the only option, it was supposed to sort of complement the other one that
exactly.
provinces would do, increase in case you needed more support. Is that?
That's exactly right. Like in case you
Yeah.
needed to take longer time off. Definitely, exactly. The word is complement. It was supposed to complement provincial responses to this. But instead the what, a lot, and it's not even just the Ontario government, it's like provinces all around Canada. What they're doing is that, they're sort of like shifting the responsibility to the federal governments when it's their responsibility to make legislated paid sick days available for everyone. They have the power to do that. They can do that.
Right.
They are ignoring health providers. Like that's why this has been such a hot button issue, because a lot of people have been really outspoken on this.
Yeah, I feel like everywhere I look, I'm seeing experts I admire talk about the need and the essential service that mandatory paid sick leave would provide, not just from a labor perspective, but from a curbing the pandemic perspective. Uh,
Yeah.
how come? So, if why aren't we like why aren't we advocating to the federal government instead of like how come it's such a focus on asking the provincial government for support here if clearly they are not interested in doing it? Like should we be pivoting elsewhere or uh,
Yeah. That's a really good question. And I just want to emphasize, like, I think we need to take a little bit of a step back to understand, like, whose responsibility is what. And I want to use the
mhm,
example of, like, health. So we know that for the majority of people in Ontario, health is through, it's like something that's like managed and governed by the provincial government,
mhm,
um, which is why we see that the provincial government is taking such a big step in and doing what they need to do. There is still some guidance from like Canada as a whole, right? But it's the provincial government's responsibility. The same is true for work. For the majority of people in Ontario, it's the provincial government's responsibilities to set standards, to protect workers on the job. It's not the federal government's primary responsibility. Um,
right, okay,
so the majority, the employment conditions are set by something, a piece of law that is provincially legislated, that's called the Employment Standards Act. So
Okay.
they could change the Employment Standards Act to do things like increase the minimum wage, to provide more strict health and safety regulations for workers on the job,
Mm-hmm.
and to bring in things like paid sick days. That is all provincial, because what the federal government is doing is saying, here, we're going to help you out with this extra complementary support.
Right.
Um,
And
but
I think I've also like, so it's also like, it's just like, this has always been a thing, the division of responsibilities between the provincial level of government and the federal, and as well as like the municipal. But in this particular case, we're speaking about the division of responsibilities between the federal government and provincial government, and labor as well as education and health, all fall within the provincial bucket,
exactly,
which is
exactly.
why advocacy efforts are focused there. So that makes sense to me, but don't individual employers have the ability to provide this? Like, why is this discussion so focused on the provincial government if we could also be asking like employers, hello, could you provide this?
Yeah, for sure. And some employers do. Like I think that we also have to remember that, but we also have to remember that the majority of employers don't. And the
Mhm.
reason that they don't is because of the minimum standards, right? So I was just talking about the
Right.
Employment Standards Act. And if there isn't a benchmark across sort of like the standards, the employers are not going to be very motivated to bring
Mm-hmm.
these policies in that are expensive to them. You know, that
That makes sense.
that like why, like they're not, they don't really have the incentive to sort of follow that and put other protections in if they don't really have to. It's similar to the minimum wage conversation, right? We advocate for like a minimum wage so that everyone has access to a minimum standard, but we know that there's tons of other employers who bring uh, higher minimum, like higher wages, right? It's the same thing with paid sick days. We have to make sure that there's a minimum standard so everyone has access to that. And in particular, that's really driven by like an equity approach to make sure, because all people, even people who don't have like immigration status,
Mm-hmm.
do have access to the employment standards. So that way we can make sure that we're like raising the floor, so that all employers are following the minimum standards.
Yeah, and I think it's also important, like as you were saying at the very beginning, unless we're like, I'm going to paraphrase this poorly, but um, like we're not protected unless all of us are protected. And in this particular case, not providing the service from for our essential, like for anyone who works in the province, is not protecting all of us, which is going to continue the pandemic as it is. Yeah. So, uh, what what would you say to what, like, I guess, well, let me rejumble my brain a bit. Um, what's going on? Like, so why isn't this happening? If it's within the provincial scope to do it, and we know that we can't mandate it at a provincial, like at an employer level, like we can't go to employers and be like individually tell every employer in Ontario, hi, could you put mandatory sick leaves in? So it has to be at a provincial level. Why hasn't it happened yet? What's going on? What's the holdup?
Yeah, that honestly, I don't know. Like, and I get this question asked a lot. There is an extreme amount of evidence about paid sick days being
Mm-hmm.
effective at reducing infection in the workplace. We know that hasn't only been like because of this pandemic. Like, there have been other pandemics that we've learned from, that the recommendations have been to improve sort of these work conditions and in between pandemics as well as within them. Um, and we have seen the huge support during this pandemic, like the 34 medical officers of health writing from Ontario writing a letter to the Premier and the Chief Medical Officer, Dr. David Williams, to legislate this. We have seen all three of the opposition parties write private members' bills, which is sort of like a legislation that because they're not in power, that they can bring to the table. They've all brought this into trying to make it into law. So there is extreme support. We know it's evidence-based. We know that it's an investment to our public health.
Right.
And I really don't know what's going on. And it's really frustrating because people are dying. Like, this isn't a joke, right? Like, and especially during the third wave, we know that workplaces are driving the pandemic, and we know that we have to do everything we can to protect workers on the job.
Have there been moves to there's a really great question, but so we'll get back to that in a second. But have there been any efforts to pass that? Like, we all have elected representatives. Has anyone tried to bring up the conversation of mandatory paid sick leave, or has it just been like a nope, no budging from anyone?
Yeah, so we have seen, in particular, I'm thinking about the Ontario NDP and the
Mm-hmm.
Ontario Liberals. They both have put potential legislation on the table. The Ontario NDP one got voted down.
Mm-hmm.
And then the Ontario Liberal, that bill is called Bill 247, which seeks to provide 10 permanent and employer paid sick days for all workers. That one is sort of still in the process of getting debated and voted on. So that one is still a potential sort of viable thing that we can all call our MPPs and say, hey, we need this. This is like a policy that's on the table. Like, we need to make this happen.
Yeah, so if anyone's watching this or watches it later, if you go to our website, which is on canadaproject.ca, and click on resources, super easy to find. We actually make it really easy for you to find your member of provincial parliament to send in. All you need is your postal code and to send an email. They work for us, so making sure to get it in front of them to be like, hello, this is an essential need right now. People are dying. It would be really great to see action behind all the things that they're saying.
Yeah.
Um,
And especially if you have a conservative MPP, like holding them accountable for like some truly reckless policy decisions that have like killed people, that continue to harm Black workers, racialized workers, women workers. Like, this is what they're doing is choices, right? And like, you said it, Sam, like, they work for us. And I just want to say that, like, employment standards change at the provincial level, because we advocate for them to change. That's why we had 1 paid sick days when we did a couple years ago in the first place.
right.
So it's definitely possible. What we're doing is that we're holding our elected officials accountable, so that they do something now, because enough is enough. Like, we are in pretty dire conditions right now. And I don't know what else we can do to try to motivate them to listen to the evidence, right? To listen to what's happening in the workplaces right now.
Before we kind of wrap up, Amelia put a really great question in the chat around: are there any provinces that have mandated paid sick leaves?
Yeah, so that's a great question. Thank you. So Quebec has 2 days.
Okay.
PEI has 1 day after 5 years of working with the same employer. So overall, on the whole, Canada is really bad.
Wow.
Canada is in the bottom quarter of countries in the world, the whole world, that don't provide paid sick leave on the first day of illness, which, like I was saying earlier, is really crucial to reducing infection in general. So Yeah, pretty startling. And there's a lot of information on this on the Decent Work in Health Network website. We did a report called Before Too Late: How to Close the Gap in Access to Paid Sick Days During COVID-19 and Beyond. So we looked at all the evidence that was out there, and we put forth a series of evidence-based principles that allow us to advocate for evidence-informed policy. So yeah, and I also want to answer, there's another question in the chat from Renee Elisa. It says, many employers are also small businesses. Yeah, definitely. And what we found is that on the whole, it's not small employers that are the culprits here, right? Like small employers usually value their employees. They know that, you know, paid sick days are essential. They know that they reduce employer turnover. They want to make sure, like, small, like, business owners treat their, like, business and the people that work there like family.
Yeah.
It is the large employers that don't. It is the large employers, especially right now, that are making record profit margins, the ones that are not providing paid sick days, that are not providing protections for the workers. Which is sort of like earlier I was talking about how, like, these large employers, like, just really don't want to take a potential pay cut to have to provide these things. Because a lot of small businesses already provide paid sick days. They're not the culprits here.
I just find that so frustrating because it feels like from my perspective, it really feels like these big businesses are being protected right now. And last time I checked, a business can't vote. Like, I voted for my elected official, so you would think that that means that the elected official works for my best interest, not for the best interest of big organizations. And so that's really frustrating for me to hear that they're the culprits. That's where we're seeing, like, giant spreads of the virus, that we know that protecting people can, in this way, will help stop the spread of COVID. It's really frustrating to grapple with the reality. And I'm sure, you know, people don't come out and say things like, well, yes, we are on the side of big business, but you're showing us with your actions. And not having mandatory paid sick leave, to me, is saying that what corporations are doing is more important than what the individual needs right now. And
Yeah.
that's kind of gross, to be honest.
Yeah. And the other thing too is, like, if there are some big concerns for smaller businesses that don't already provide paid sick days, like, there are ways around it to really just make sure that this policy is being delivered, especially during such a critical time. The most important part for us, and, like, this comes from our recommendations from our report, is that they're legislated so that they're for all, which is a piece around, like, provincially mandated.
Right.
But, like, you know, I think that also comes with the understanding that there are some, like, businesses that are really struggling, but overall the large ones can definitely afford it. So we don't want to inadvertently subsidize these big businesses. Anyways, I could talk about this for days, but yeah.
Yeah, and I think I'll maybe ask you if you have anything else to add. But before I do, and we wrap up, I always find it really interesting. I'll just, like, say it, that our country loves our healthcare. Like, we're very proud of the health sector as a whole, and the fact, you know, our American neighbors don't have public healthcare, and we do, and we're really excited. But truthfully, health and protecting all of us, like, from, and ensuring we all have access to good health outcomes, is not just being able to access a hospital for free. It's all this other stuff. And it goes back to what you said earlier with the direct correlation between your income and your health. And so then therefore your work and your health, all these areas, it's almost as if we need health in all these policies in order to ensure that people are able to just access this incredible healthcare system that we're so proud of, right?
Yeah. And yeah, like health is definitely more than the care that like me as a nurse or someone as a doctor or a nurse practitioner or social worker provides. That's why we like really focus at the Decent Work and Health Network of conversations on like the social determinants of health, the other factors that really influence whether you have the ability to be healthy or non-healthy. I think there's a question.
Yeah. Um,
Um,
is there anything we can do? Girl, I feel you. I too have made calls and signed those petitions. Um, from my perspective, keep doing it. Get people to do it, especially if you're in a neighborhood or if your riding is like a Ford's government, like the Conservatives. Um, and keep doing it. I find that when I tweet at them, because it's publicly facing, I sometimes get maybe some sort of recognition, but yeah, I would recommend to keep doing it. It's tiresome, but if you have time to, uh, definitely keep reaching out. Is there anything you would add to that, to what people can do? Like what can we do really?
yeah, so I think that like what can we do? I think that question is also based on what are our goals, and um although having like a legislative win is really important, like the really important thing um, is that we are like standing up and showing up for each other,
Yeah.
like solidarity with people who are like working in essential workers. So that it means exactly some of the things that you've said, like talk to your neighbors. It means letting them know that there's a fight for these things happening. It means hosting your own local phones app. It means leafleting and putting up posters within your community.
Mm-hmm.
It means trying to get a meeting with your own elected official. And like I think in just an understanding that like a lot of what we do is it's it's not a matter of if this is going to happen, it's a matter of when, right? Because we're definitely going to win it. So it's a matter of when. So just understanding like that and continuing sort of like that hard, grueling organizing work is super important.
I think that's so key. Like it will happen, but when will it happen? But also the longer it takes, the more people who are left in the middle, caught in these like precarious work conditions. Um, yeah, so hopefully sooner rather than later, but that really falls on our provincial leadership. Um, if people were looking for more ways to do things, is there stuff on your website or maybe the Instagram account, Decent Work and Health?
Yeah, for sure. So follow us. You can follow us on Instagram at Decent Work and Health. We also have a website that you can use to sign up. We do send sort of like weekly to bi-weekly newsletters talking about different events that we have going on. There's a couple of meetings that we have next week. We have a meeting on the 20th, which is like a broader organizing meeting with like a couple of our other community partners, which will be really exciting because we're going to be sort of relaunching our campaign May 1st. And then we're going to have a meeting for health workers on the 22nd of April, so just a couple days later. And then our sort of relaunch of the campaign on May 1st. So that'll be really exciting. And we'll be doing all sort of virtual events. So definitely sign up for our newsletter. That's probably the best way that you can get plugged in. Also, you can just like follow and DM us on Instagram if you want to get more involved, if you want to have a little one-on-one conversation with me, if you want to share your story. Those are all things that are totally possible, and we're
Yeah,
super happy to see them.
I can confirm. I slid into your DM.
You
So
did. You
it,
did.
yeah, so I 10 out of 10 recommend people do that.
Yeah.
And I honestly feel like I'm so much more informed on this subject as a result. So thank you so much for collaborating with our project and just being available to answer some of these questions, because I know so many of us are confused. It's not easy to learn about this stuff, but it's essential that that decent work is available to everyone, starting with mandatory paid sick leave. So
Yeah.
yeah, I'll when we share this after, I'll make sure to link the account so that people can check you all out. But is there any other final thoughts before we call it?
No, just thank you so much for all the great work that you do. And yeah, super happy to be involved.
Well, thanks so much. And thank you everybody for tuning in. And to anyone who watches this later, as always, drop some comments, questions, and thoughts in the chat thingies, and DM us, either of us. So thanks so much, and have a great evening, everybody.
Okay. Bye, Sam. Bye, everyone.
Bye.